That's probably a nice segue to go back into this coronavirus. One of the questions that we've got here from Stuart Addis, how long is the incubation for the virus and what are the symptoms that people might be getting?
The first thing to ask is what do we mean by the incubation period? So the incubation period is the time when you first get infected to the point you develop the symptoms. And for coronavirus, it's quite short. It's usually only 2 to 5 days. An average of about 4 or 5 days from the case series that we've had from China. So on the balance of probability, if you've not got symptoms within the first week, then you're unlikely to get it. However, as a precaution, because there's variability in the individual and the virus, we say that, let's say you've come back from China. If you do not develop symptoms in the first 14 days after return, you should be fine. Okay. So 14 days is the cut-off.
And how confident are we in that 14-day cut-off?
Very confident, because we've got lots of data from similar coronaviruses, and if you look at the molecular structure of this coronavirus and compare it with SARS, it's actually very similar. Okay, we think it's even the same receptor. The main difference is it's much milder. SARS was more serious, and there was a higher mortality with that. So, but the new coronavirus, COVID-19, it's behaving in a very similar way to the influenza virus.
I think that a lot of people get worried. Is it safe to fly? Can I go in a metal tube, and come out safe on the other end?
It's a good question. Listen, it's a new virus, so people have not encountered the virus, and therefore people are going to become infected until the virus stabilizes in each of the countries, in the communities, just like the swine flu. The important thing for people to bear in mind is that it is a virus that's spread by droplets, and therefore going on a plane is not high risk at all. You go on your holidays, go to the countries that you want to visit. At the moment in the UK, the Foreign and Commonwealth Office are recommending not to travel to China unless it's essential.
So I'm all right to go on holiday to Italy next week?
Absolutely.
Perfect. I need my pasta. Okay. You say that we know it's not that infectious. Let's put it in context that people can understand.
Okay.
I know if one of my patients comes in with flu, I'm going to say, rats, I wish I'd got around to getting that flu jab. How effective or infectious is the coronavirus compared to flu?
Okay, so viruses, and that includes coronavirus, are obligate intracellular parasites.
Medical school was a little while ago. Go through that one again.
It was longer for me, actually, James. All right. So
yeah, but I'm a GP now. I know a lot about a little. No, I know a little about a lot.
Yeah, well, you guys are very experienced. Listen, if you break that phrase into each of those words, obligate means it has to. Intracellular means it has to live within a cell, a living cell, a human cell, for example. Okay. Mm-hmm. Parasite. So a parasite relationship is where an organism lives on another organism to survive, but if it's taken out of that situation, it can't survive very well.
Take that as a perfect example.
Yeah, exactly. Okay. So viruses are organisms that they need another living cell to survive. So when they're outside in that cell, on a fomite means anything inanimate, like a table or a book or any other surface, they can't survive for very long. And we know from the evidence we have so far for coronaviruses, they survive about as much as a flu virus in the external environment, about an hour or so. Okay, they can't survive very long. And if you wipe the surfaces down, or you practice good hand hygiene, washing your hands, then you even eliminate that risk as well.
So we have mentioned about people, wearing masks and things. But correct me if I'm wrong. But my opinion is that a mask isn't going to do much to protect a patient from getting, infection just walking down the street. But as you said, just that good hand hygiene, making sure they're washing their hands, potentially using alcohol gel, that's how somebody protects themselves from getting this, isn't it?
Yeah, absolutely. Because it's droplet spread, it's often contact. They touch surfaces and then they mess about with their eyes or the nose or the mouth, or people who might have influenza or coronavirus will cough and sneeze over people, face to face, like me and you are. So face to face usually means about a meter, about arm's length. All right, and that's when you get infected. You don't get infected when you're walking down the street or walking through an airport. Okay, it's close face to face contact when somebody coughs or sneezes, and when you touch. So when you wear a mask walking through an airport, you're more likely to touch surfaces that are infected, and then you're more likely to touch your face, your nose, your eyes, or mouth. And I personally think masks are worse and increase your risk of infection, particularly in that context.
So we've got a good question from Gordon Claydon. What treatment is being used on the people that have contracted the virus? I mean, my take is that if it's like influenza, we just sort of tea, sympathy, and a bit of chicken soup.
Well, with influenza, first of all, it's supportive therapy, like you said, plenty of hydration, chicken soup if you want to, if you're not vegetarian. But if you're hospitalised, if you're severely ill, we can give a drug called saltamivir, or the common name is Tamiflu. For the coronavirus, most people, again, consider to them because it's a mild disease for most people, and drink plenty of fluids, take paracetamol, and you'll get better. However, a small group of patients will be severely unwell and they'll be hospitalised, and we don't have a well tried and tested drug at the moment. There is a drug called remdesivir, and that is being trialled at the moment in China. Now, it's been used sparingly in other coronaviruses in the past, but it's never been used for COVID-19, the new coronavirus. It's been used in humans, so therefore we know it doesn't have any serious side effects. Okay, so we're happy to just go along and actually try this, and hopefully it might be effective.
Ultra Wanda has asked, why is the coronavirus fatal? Which I think is quite an interesting question, given what we've just talked about. That for most people, it's kind of like flu.
I'm glad you asked me that, because I think this is an important question to answer, should I say? The bottom line is, less than 3% of people will die if they're infected with the coronavirus. Some people have a very mild disease; they hardly know they've got it. So let's take things into context. The flu virus, okay, it infects about 5 million people, at least confirmed cases around the world, and it can kill about 600,000 people a year. Okay,
that's a lot.
That's a lot more than the coronavirus. Okay, the coronavirus, as I said, has got a case fatality ratio, so the number of deaths compared to the number of cases, of about, to be precise, 2.8%. Okay, but it's less than 3%. Okay, so it's not universally lethal, and so people need to understand that the people who are fit and well are likely to have a mild disease. Where it can be severe, where it can cause a pneumonia, and people can be really unwell, are people who might have underlying health problems. So people who might have chronic lung disease, heart disease, they may have cancer, or they may have a weakened immune system, or they're older, over the age of 50, 65, and they're much more vulnerable and they're more likely to get severe disease.
So the fact that Netflix is suggesting I watched Pandemic last night is probably just marketing, and that's not what we're looking at.
Well, that's just, I don't think that's helpful. Okay, the word pandemic has got connotations of films and people with masks and people in isolation and people dying everywhere. Now, what does the word pandemic mean? Pandemic means when you have a new disease, like a new virus, that people, the human population, have not encountered, and it begins to affect multiple regions around the world, for example, multiple continents.
So SARS, that was a pandemic, wasn't it?
Yeah, and technically, by that definition, you could argue that the coronavirus is a pandemic because it's a new disease and it's affecting several continents, okay? But it hasn't got sustained spread within other continents apart from sort of Southeast Asia. So I don't think we're quite there yet. What you want is sustained spread, and you haven't got that. But from a technical point of view, people might argue that. And so what? The swine flu pandemic was there. Okay, it's now transferred from being a pandemic to an endemic disease. So now swine flu is circulating within the population of Europe, or through Asia, or through North America. Okay,
and that's not in the news anymore, even though it's still there.
In fact, it's probably there are more cases of flu every year, and there are. Okay, but it doesn't make the news. It's, more people are dying from flu, but it doesn't make the news. So we've just got to be careful of the word pandemic and not be too alarmed by it.
So we seem to be going back several times to this coronavirus versus flu. Given the choice, I think that I'd probably prefer to tangle with coronavirus than a straightforward influenza at the moment. That's the impression I'm getting.
I think if you are fit and well, okay, you have a very similar disease. Okay, often the coronavirus will be milder from the evidence we have so far if you're fit and well. But I think if you have underlying disease, a pre-existing medical condition, or a weakened immune system, they both can be severe. Okay, and I wouldn't want either of them, to be honest. Okay, I think the slight advantage with influenza is that there is a vaccine. Okay, at the moment with coronavirus, we don't have a definite treatment or a vaccine, and that's why it's important to practice good personal hygiene. So if you are, if you're symptomatic, if you have a cough or a sneeze, if you're sneezing, make sure you use a tissue or handkerchief when you cough or sneeze. If you haven't got that, use your arm or your elbow, okay, to stop the disease from spreading. Bin it, dispose of those tissues properly into a bin, and then make sure you kill it. Wash your hands or use alcohol gel afterwards. With good personal hygiene, we can prevent the spread of this virus. And what's really important is you need to make sure that if you've got symptoms, you don't go around on public transport or go on a flight. Don't go into a hospital if you don't need to go into hospital. If the symptoms are mild, stay at home.
Yeah. Okay. So, it's the things that you'd expect people to be doing anyway. Be polite, be considerate about other people if you're unwell, or so you'd hope anyway.
Yeah, but people aren't always polite, are they? They sneeze and cough all over you, and you can't control that.
No.
Okay? But you can tell them.
Or you can try and get a flu vaccine.
Yeah, so it's really, really, really important that if you've not got the flu vaccine, get it. It's cheap. Okay, you can get it from local pharmacies in the UK. Travel clinics do it, and if you've got a pre-existing disease like heart disease or cancer, your own family doctor can do it free of charge. All right, and it's still not too late to have the flu vaccine. You can get it late in the flu season because in the northern hemisphere the flu season starts it varies. It actually started early this year, sort of mid-October. It usually starts in November, December, but it started early this year. But it can extend towards March, April.
So I may have been on holiday when the vaccinations were done at my practice and then subsequently forgotten. Would you say it's still worthwhile getting a flu vaccine now?
I think so. And if you want, James, we can do it for you while you're here.
I walked into that one,
yeah,
didn't I?
Absolutely. Listen, it's now February. There's still a high risk for you because you're vulnerable. You're vulnerable because...
I'm not vulnerable, I'm 35.
That's quite old, actually.
I'm going off you rapidly.
So you're vulnerable because, okay, no, jokes aside, you're going to be encountering patients who will have the flu virus. Okay, now you're vulnerable because I've already told you that you can have serious complications with flu. In fact, healthy, very sadly, healthy kids in the UK in a modern, advanced healthcare system die of influenza. A handful of kids die and they've previously been fit and well. So it's really important that you get the flu vaccine for your own safety, but also you're going to be off work. Okay, you're going to be off work for a week. That's a week's loss of income. So it's really important for a number of reasons that you get the flu vaccine.
And also, if I'm off work for a week, it means no one's going to treat my patients.
Absolutely. So it's a multiplier effect, if you like, right?
Go on then, let's play devil's advocate then. People are always going to say, if I have the flu vaccine, isn't that going to give me flu?
You can play the devil's advocate if you want to, but actually, that's not true. The flu vaccine contains the killed flu virus. It doesn't contain a live virus. And for you to get the influenza, you need a live virus. Okay, that's the important thing you need to understand.
Absolutely. And that's what, so frequently I'll say to patients, that's why we'll give it to people who are on chemotherapy, people who don't have an immune system, because
Absolutely.
we would kill them if we were giving them a live vaccine.
Absolutely. So people think, well, if I've got pre-existing medical problems, or if I've got a weakened immune system, or if I've had chemotherapy, perhaps I shouldn't be getting these vaccines. In fact, the converse is true. As long as it's not a live vaccine, vaccines are even more important in these vulnerable groups. So these groups should be vaccinated for flu.
So what about somebody who's got a cough, the cold, they're a bit under the weather? Does that going to affect their ability to get the vaccine?
So often if they've got a cough and a cold, and if they're a bit sniffly, it's more likely that they've got the common cold. Okay, and that shouldn't really prevent you from having the flu vaccine. It's only if you've got a high fever of more than 38 degrees centigrade, or you're really unwell, that's when you probably ought to delay or defer having the vaccine. Otherwise, just go and get your vaccine.
Okay. Well, I tell you what, let's get that vaccine sorted today, since I'm here.
Absolutely.
Seems appropriate.
Yeah, good.
Well, thank you so much for the time today. It's been very interesting for me, and hopefully it's helped a lot of people at home who've been getting worried about things. So thank you very much indeed.
Not a problem, James.
Time for the stabby.
All right, James, you asked for it. You said you had not been vaccinated, and you are a healthcare worker.
Yes, I will hang my head in shame.
Yep. You should do. Well, at least you've salvaged yourself, so we're going to vaccinate you. So this is the influenza vaccine. It's got 4 strains. Yes, it covers all the main strains. You're not allergic to anything, are you?
No. Penicillin, theoretically. But...
Okay, that should be fine. You're fitting well?
Yep.
Okay, good. Are you okay with needles?
Yep.
Do you want to turn away?
Whimper.
Right, I'm just going to turn away myself, because it's always scary when people show the needle before the vaccination goes in. Right, ready?
Mm-hmm.
You need your left arm, so you need to take that arm out. So it'll feel a little bit cold. Right, it's going now. Sharp scratch. A bit cold. All done.
I'm not dead. Yes.
So you're sorted for this flu season, but you'll have to come back for another one next season.
I'm sure we can sort that.
Good.
Right.
Done.
Thank you.
You're safe.
Right, well, I'll leave you with your infectious disease patients and return from whence I came.
Stay well, all right? I
Thank
can
you,
come
sir.
back next year.
Okay. Well, I think that we've all got a really good understanding of the background to the coronavirus now. And to be honest, I think that we can see that whilst it is worrying for many people, I think that we've got many other things that are more important out there. Yes, I've been taken to task for not having had my flu vaccine, but I think if you've been watching this video and learning that little bit more about the coronavirus, if it's been something that has had you thinking and worrying and watching all the news reports whenever they come out, if you've been in that situation, then Dr. Gowda has showed us today how, in fact, common or garden influenza, flu virus is actually probably going to be a bigger worry for you, in which case we already have a vaccine there. So toddle along to your pharmacy or talk to your health professionals and get vaccinated. So hopefully that's something else that'll take a bit of worry off your mind. If you found this video useful, I'd be really grateful if you could consider whether or not it would be worthwhile sharing this with somebody else. This is all about education here and trying to help people understand the science behind some of the slightly alarming news reports we get. Well, thanks very much for your time, and I hope you found a benefit here. If you've got anything you'd like to add, please stick it in the comments below and I'll try and get back to you. Thank you and have a good evening.